Okay, that is a collateral tibial ligament. And there is something absolutely to check. You have some femoral tibial ligament, okay, coming from the femur to the tibia. We have some femoral meniscus ligament and tibio meniscus ligament. And we'll try to make the difference between both. Of course, you cannot do something without being precise. And this ligament is flat. It's not the same thing as the lateral one. Okay? And that is very important because, remember, that's a medial meniscus. It changes fibers with the collateral ligament. If you do something on the meniscus and you forget this ligament, it will come back at once. It's why it's so important to be so precise. Also, there is another one going from the meniscus to the patella, meniscopatellar ligament, okay, at this level. A knee is always more complicated than we believe, okay? And of course, at the beginning of my career, I did not understand what was a knee, and thanks to my knee, because I was hurted when I was young, playing football, American football, okay? And I'm not the type of guy to play that kind of stuff. So that is very important to check the attachment of the meniscus. So we will do it right after the break. It's something very subtle, and when you release this part, you release the entire part, you're more sure that the meniscus will stay in the same place. Because what you have done at the beginning, meniscus is a little anterior. You push it a little back. You try to balance from lateral to medial. But after we have this stuff, and each time you have a tension of the knee as the meniscus is affected each time. Quadricipital tendon, you come a little underneath, you move at this level. I will do the drawing after. And now you are against the bone, and you try to make move from lateral to medial, okay? This muscle as a whole, that is a capsule like it. This muscle as a whole to maintain the capsule in tension. When you flex, when you have some extension and so on. So I repeat, you have the patella, you have the quadricipital tendon, okay? With your finger, there is another muscle we call intermediate, vastus intermedialis, okay? You move, you go against the bone, okay? And you make move like it. You make move like it. Okay, you are deep. You make move against the bone. And there is what you call quadricipital bursa at this level. And when there is some tension on the knee, this bursa becomes thick. On the synovial, you have a big risk to have synovitis. Capsule tensors. They play like tensors of the capsule. A capsule is a fold which is very supple. And this capsule has some little folds. And a good capsule, try to expand the maximum, not to be too squeezed and so on. And when we play on this muscle, we play on the capsule and we make expand a little the capsule in order to avoid that kind of what you call plicata of the capsule. And when you have a plicata, of course, a plicata is like it, okay? That is a capsule. When you have a plicata, the capsule is like it. And of course, inhibit all the mechanoreceptors that you have in this part. Like a good capsule must be like it. Bad capsule is totally like it. So good. It's why after surgery, you have no choice. You must do it after surgery because the surgeons, they don't take care about it. They open, and you know, sometimes the worst is when they do with fibroscopy. It's worse because they move a lot and they destroy a lot of things. So it's why after surgery, you must try to give some peace to this muscle, to this ligament. D'accord? That is the semimembranous. The semimembranous come here, okay, here, and give some fibers, exchanging some fibers, going laterally with fabella, or the concentration of fibers also, and going some fibers going to the popliteus muscle, okay? So what we will do, if we'll do on the back, but you must, you have the biceps here, biceps, adductor manus, semitendinous, semimembranous, okay? And you try to feel the fibers. Semimembranous is the brain of the posterior part of the knee. the semi-membranous. Because they have a lot of expansion going to the capsule, okay? This muscle is very smart. We must not miss this muscle. It's smarter than the semitendinous, okay? Put your two fingers. Your two fingers here, you have two tendons, 1 and 2. D'accord? Okay, so you follow the tendon. If the tendon stops here, it's the semitendinous. If you stop inside the knee, it's the semimembranous.
So this one out here is tendinous. This one here is membranous.
Semimembranous.
And it feels in this position like it's not deep.
Here it's not deep, but after it goes deeper, deeper, and deeper. Okay. So when we do some joint manipulation, it's in order to get some negative pressure, to increase the negative pressure, or to restore the negative pressure in the joints. It's very important to make glide the joint, and also for the arterial system, vascular system, nervous system, and so on. So the key point for us is to free the joints to restore this negative pressure. Les petites mademoiselles, le ha dans titadidoudou, toutoudidou, toudidounou, toutouditoudou, toudoudidananou. Toutatitata, tidoudou, toutitidoudou, toutoutoudou, toutitidoudou, toutitidoudou, toudoudou. Les petites mademoiselles, le ha dans titata tiditata touditoudida toudidada